Together we achieve victory over heart failure.
Hello everyone, myself Dr. Biswaranjan Jena. I am an interventional cardiologist practicing at Cuttack. So today my topic will be on heart failure. I want to share some insights about heart failure with you people. As you all know that heart failure means if you talk about cardiovascular diseases, then one of the most important disease is heart failure. So in current time, heart failure as the age of the persons means as we are living longer, the chances of getting heart failure is getting more. And thing is that everybody should know about heart failure nowadays. And the next thing is we can divide heart failure into two types. One is heart failure with preserved ejection fraction, technically as we are saying. That means there will be heart failure with low pumping of your heart muscles, means your pumping of the heart muscle will be low. And another type of heart failure is there, which is heart failure with preserved ejection fraction, means your heart pumping will be normal, but receiving will be problem. Thing is that heart have two functions, it receives the blood and it pumps the blood. So once pumping is affected, that is known as heart failure with reduced ejection fraction. Once receiving is affected, it is known as heart failure with preserved ejection fraction. We have to differentiate between these two things because the treatment modality is different for different types of heart failure. So once we are talking about heart failure with reduced ejection fraction or preserved ejection fraction, the risk factors are usually same. If you have hypertension, if you have a past history of heart attack, if you have a diabetes, which is very prevalent now, and if your age progresses also, and if you have any form of congenital heart disease, from childhood, if you have a sort of heart diseases. So these are the major risk factors for having heart failure. So once there is heart failure, it is diagnosed. How to diagnose it? You have to go to your physician. And what are the symptoms of heart failure first? Once you have a heart failure, the symptoms will be, you will be easily fatigued, means your effort tolerance or whatever work previously you were doing, you cannot perform that type of activity now. Second is if there is swelling of your limbs. Third is if you have shortness of breath when you are climbing a stair or you are walking normally. If you have shortness of breath, then also it's a sign of heart failure. And sometimes your heart get palpitation. You will get palpitation, means your heart rate will be unusually high with low activity also. So that time you should think that, okay, I may be suffering from heart failure. And if you have previously, as I told, if the risk factors are there, then you should be more vigilant. If you have hypertension, diabetes, or any heart attack previously, or childhood disease of heart disease, or your age is more, then you should think more in line of heart failure. So once you are getting to the doctor, what he will do? So basically, we will do routine tests, like we will do a ECG, we will do a echocardiography. So in ECG also, there are certain things which can tell us that, okay, this person is getting heart failure. But the main diagnosis was done by echocardiography. So once you do echocardiography, what we see in echocardiography, we see how the heart is pumping. If the heart pumping is normal, still you are having symptoms, then we have to have some little, there are certain blood tests which we send, like NT-proBNP, then troponin T, and specifically NT-proBNP. So this is a enzyme which is released by heart. So once the heart muscles are under stress, this enzyme will get elevated. So once you are having heart failure, with echocardiography, one additional test is blood test, that is NT-proBNP. After that, we diagnose that, okay, you are having heart failure. Then which form of heart failure, whether your pumping is less or your receiving is in problem. So once we diagnose you as a heart failure, then initially we try to put you under certain medications. Exercise, diet, you have to consult the physician, how much exercise you can do, that is very important. Then what diet you should avoid, then what should lifestyles you should carry out. Diet means you have to take low salt diet. Your water restriction is required once you are diagnosed with heart failure. And definitely other organ also we check. We see what is your kidney function test. We check what is your cholesterol level in blood. So accordingly, we treat those things also. So basically, once you are diagnosed with heart failure, we have to control your sugar, you have to control your blood pressure, and then additional, you have to take some specific medications for heart failure itself.